How to avoid pain in fibrocystic breasts. A sense of hardening and pain in the breasts, especially before the beginning of a menstrual cycle, is very common in adult women. Here we will provide information on how to avoid pain in fibrocystic breasts. This discomfort is caused by what is known as fibrocystic breast changes, which can appear in breast tissue due to different hormones. It is believed that these fibrocystic breast changes could affect up to 60 of women between the ages of 30 and 50. Symptoms of fibrocystic breast changes. These are some of the most common symptoms among women whose breasts experience fibrocystic breast changes. When touching the breast, nodular areas can be felt, with widespread hardening or irregularities in the breast tissue, especially in the few days prior menstruation. Pain and sensitivity in the breasts. Soft and mobile cysts full of liquid may also appear. Nipple secretions, either clear or lightly cloudy in color. It is important to point out that if you notice nodules or any other irregularities in your breasts, you should consult a physician so that they can perform the appropriate diagnostic testing. The doctor may order you a mammogram, or an ultrasound mammogram, to rule out other illnesses. Since fibrocystic breast changes are so common, and present no greater health risks for women, physicians do not consider this to be an illness. But, at any rate, lots of women look for ways to alleviate the tension and pain in the breasts caused by this condition. Continue reading to discover the answers to these questions. Reduce salt intake. Some people recommend reducing salt intake, or salty foods, so the body doesn't retain liquids. In theory, this could work to alleviate symptoms brought on by fibrocystic changes in the breasts. However, there are still no scientific tests that prove the efficiency of this method. Avoid teas, coffee, and carbonated drinks. Beverages such as black tea, sodas, hot cocoa, and coffee all have one thing in common: they all contain substances from the same family, known as methylxanthine. Some women claim that by avoiding these drinks, for at least a couple of months, they experience relief from symptoms brought on by fibrocystic breast changes, which is to say, they experience less pain and discomfort. Use a semi-orthopedic bra, corset. Excessive compression of the breast tissue can cause more fibrous areas to form in the breast, which hurt as well. That's why, to relieve this discomfort, it is important to use a bra that does not contain metal bars, wires, in them, with a cup covering the entire breast. Specialists recommend only using bras that meet the following criteria. The band wrapping around the torso should be wide, and not too tight. There should be enough space to slip one finger easily between the breast and the cup of the bra. Straps should be wide, and never leave marks on the skin. Several specialists also recommend removing bras to sleep. If you are large-chested, you can wear a cotton top, rather than a bra, when you go to bed. And lastly, Always remember the importance of consulting a physician if you find any irregularity in your breasts, so as to rule out any potential illness.